Hello guys, welcome back to the channel. So this is one of a video of a kind where we'll be discussing the entire path from starting from the general path to the hemat to the systemic path. So I've included the most high topics so that you can revise it at the last moment. So this is must watch, and also at the end all the images, histopathological images, and the important one liners that may be asked in your exam, all the important tables from the Robbins like the tumor markers table and other important table has been included in this. So let's get started with the first chapter. So starting with the chapter of cell injury, guys. Okay, so if we see most common cause of cell injury, guys, that is hypoxia. What is the most common cause of hypoxia? Ischemia, that is decreased blood supply. Okay, then coming on to the cell most sensitive to hypoxia, that is your neuron. Okay, nervous systems ka cell least sensitive to hypoxia, that is your fibroblast cell. Then reversible cell injury, the first organelle affected is the mitochondria. And what is the first change, guys? That is decrease in ATP production. ATP is the powerhouse of the cell. So when you have hypoxia, less of oxygen, ATP production will decrease. And what is the first morphological change, guys? Either it is the cellular swelling or your hydropic change. Again, this is important. Then coming on to the myelin figures, guys. Okay, this myelin figures are seen in both reversible and irreversible cell injury. Again, this is a PYQ, guys. So how does this myelin figure appear? This appeared as a concentric lamination, and since these photos appear black and white, this is an electron microscopy photo, and this is made up of phospholipid and calcium. Again, important. Now moving on to the next one. What is the deciding factor of irreversible cell injury? When does irreversible goes into irreversible? When you have a membrane damage or you have a mitochondrial damage. So what is the special hallmark that you see there, guys? Okay, so this amorphous densities are seen in irreversible cell injury. Important. These amorphous densities are made up of calcium. Okay, and they are found within the mitochondria. Again, important, because you have mitochondrial damage and you have membrane damage here, guys. Then what are the nuclear changes, guys? If you have a look, you have pycnosis, karyorexis and karyolysis. So pycnosis, look at the photo, guys. Nuclear material has come and condensed, that is condensation. Karyorexis, rexis means breaking down. Okay, X has gone, that is fragmentation. Then karyolysis, that is nuclear dissolution. Now coming on to this necrosis, guys. Okay, so what is the most common necrosis, guys? C for coagulative, C for common. Then coagulative necrosis, guys, it occur in the solid organs. So basically here the tissue architecture is preserved here, and the most common organ involved is the heart, guys. Example, MI, myocardial infarction. And how does it appear, guys? It looks like a ghost appearance. So this microscopy examination shows the ghost cells. Also, these ghost cells are seen in a skin tumor, guys, that is your pilomatrixoma. Again, important, this may be asked in your INSCT type of questions. Then coming on to liquefactive necrosis, guys, as the name indicate, guys. Okay, so basically this occurs in a non-solid organ, guys. So here the tissue architecture is not preserved like you see in the case of this brain, guys. Okay, so this is also termed as, guys, collicutive necrosis. And this and brain, pancreas, these are the major organs that are involved in your liquefactive necrosis. Then coming on to the caseous necrosis, guys. Caseous means CG like material, so that will be seen in your TB ka infection, histoplasma infection, coccidomycosis, guys. This all the fungi like histoplasma, it is also known as Oyo disease, Darling's disease, guys. So all of this has been discussed, guys. Okay, this coccidomycosis shows your shows typical appearances, guys, which has been discussed in the microbioca video. Then why does this caseous necrosis, this cheese like material? Because there is a lipid content in the cell wall, guys, and you know in Mycobacterium tuberculosis, guys, there is mycolic acid, guys, and this is 20% acid fast. So this is the image, guys, how it appears. It looks like a cheesy material, guys, pulmonary TB. Then coming on to the fat necrosis, guys. Okay, so basically fat necrosis is, guys, you have chalky white precipitate. Why? Because of the calcium, guys. Okay, it get precipitated. So it is either due to trauma, guys, that is breast trauma, guys, or in the omentum, guys, due to pancreatitis, that is your fat necrosis. Then coming to fibrinoid necrosis, guys. Okay, so you see all around, you see a densely pink color eosinophilic material around, that is a fibrinoid necrosis, guys, this one. So there is an antigen antibody reaction. So this is seen in your polyarthritis nodosa. Then SLE, systemic lupus erythematosus, rheumatic heart disease, hypertension, guys. Did you have a look? All of these are three-letter things, guys. HTN, malignant hypertension, RHD, SLE, PAN. So you can easily recall with this. Now coming on to some special necrosis pattern. So first is the Jenkins degeneration, guys. That is seen in your typhoid fever, guys. Okay, this is again important, and this is a type of coagulative necrosis. And what are the organ involved, guys? It involves the skeletal muscle, that is your rectus abdominis and the diaphragm. So here it was Jenkins degeneration, guys. But someone, if they ask you Jenkins diverticulum, the question goes to the ENT, guys. That is the space between the cricopharyngeus and the thyropharyngeus, through which diverticulum food comes out, guys. That is example of pulsion diverticulum, that goes to the surgery. Then coming on to the gangrene, guys. This dry gangrene is an example of coagulative necrosis, and this wet gangrene is an example of liquefactive necrosis, also known as colliquative necrosis. Then apoptosis literally means falling off, guys. Okay, so this is the caspase dependent. So guys, see, caspase, what is the full form? C means cystine residue, which cleaves out after ASP, aspartic acid residue. That is a caspase dependent. So guys, see, we have initiator caspase and we have a executioner caspase, guys. Okay, so see, executioner caspase is fixed, that is 3, 6 and 7. In initiator, guys, we have two pathway. One is the intrinsic pathway, one is the extrinsic pathway, guys. So intrinsic, guys, IN, that is, if you do it opposite, guys, that comes out to be 9, guys, NI. That is intrinsic pathway uses the caspase 9. If you look out at the extrinsic pathway, guys, okay, EX, E for 8 and X for 10, guys. Okay, that is your factor 8 and factor 10 is there in your extrinsic pathway. But guys, this factor 8 is absent in humans, guys. So when you see the pathway, you will see only factor 10 playing a role, guys, because that is not there in humans, guys, factor 8. Then this caspase pathway extrinsic is activated by 8 and 10, guys. You can have a look. And this intrinsic, guys, is activated by your factor 9, guys. Okay, this we have already done. Now see, all this pivotal role takes place around the mitochondria, guys. Then coming on to the pro-apoptotic molecule, guys, and anti-apoptotic, guys. So remember like this, guys. Okay, this is anti-apoptotic molecule, so it is decreasing. So you see L, BCl2, MCl1, BClXL. But here you see L is there, but here S is there. Stimulating is also there. So both will cancel and it becomes pro-apoptotic, guys. Okay, that is important. So pro-apoptotic is P53, backs BClXS, guys. Now coming on to the anti-apoptotic factor that prevents memory B cell death, guys, that is BCL2, which is an anti-apoptotic factor, guys. Okay, then which play a role in chemotherapy resistance, guys, that is your MCL1, chemotherapy resistance. Okay, then coming on to the flip, guys. This flip is the anti-apoptotic molecule which is seen in your extrinsic pathway. Then you have stress sensors, guys. Read it like a song: BIM, BID, BAD, PUMA, NOXA. So you will remember it: BIM, BID, BAD, PUMA, NOXA. That are the stress sensors, guys. Then coming on to apoptosome, guys. So what happens? This basically this cytochrome C combines with APF, guys, apoptosis activating factor, to form wheel-like hexamer, guys. You won't believe this wheel-like also has been a PYQ, guys, that has been tested upon. So like you need to know each and everything. Now coming on to apoptotic body, guys. So what happened? There is a structural change, guys. This phosphatidylserine, they move from inside to outside, guys. This phosphatidylserine, and microscopically, if you see apoptosis, guys, there is a cell shrinkage. Look at the image, guys. And there is an increase in eosinophilia. Then marker of apoptosis, annexin 5 is a marker of apoptosis, and annexin A1, guys, hairy cell leukemia. Do not get confused. Okay, then molecular marker of apoptosis, that is CD95 for the FAS1, guys. Okay, you remember the intrinsic pathway was the mitochondrial wala pathway, guys, and extrinsic wala was the death receptor pathway or FAD pathway, FADD pathway. Okay, then hallmark of apoptosis, guys, nuclear chromatin condensation. This is again a PYQ. And if someone asks you neuronal apoptosis, guys, that is activation of apoptosis inhibiting factor AIF. Then if you look at the gel electrolysis, guys, okay. So see, apoptosis shows the presence of step ladder pattern, and necrosis, guys, okay, shows the presence of a smearing pattern. This is the step ladder pattern, guys, and this one is the smear pattern, like you used to smear a slide, guys. Okay, and when you talk about this tunnel test, guys, okay, this apoptosis is positive for tunnel test, guys, and this necrosis is negative, guys. Okay, you can see, guys, it's written here. Okay, then this step ladder pattern is due to internucleosome cleavage at 180 to 200 base pair, guys. Again important. Then physiological apoptosis, like it takes place in embryogenesis, guys. Okay, then cancer chemotherapy, so you have apoptosis more than necrosis. Councilman bodies are seen in your pathological apoptosis, like your viral hepatitis. Then coming on to necroptosis, guys. Okay, so this necroptosis is a caspase independent, but it is a programmed cell death, like your apoptosis, guys. Okay, it is the caspase independent but program. So father of feature of necrosis, guys, morphology resembles apoptosis, that it is the program cells there. So here what happens, TNF receptor combined. So you have RIP1 complex, RIP3, and you have procaspase 8, guys, and this takes place in growth plate ka formation. Now coming on to pyroptosis, guys. So basically pyroptosis is basically pyogenic, remember, like microbial agent, guys, where you have not like receptors. And here you have caspase 1, 11, 4 and 5. This 4 and 5 were recently added by the in the Robbins, guys. And pyroptosis means fever and other thing, guys. So interleukin 1, you can remember fever wala interleukin. Now anamycosis, guys, it is a type of apoptosis, guys, where cell detached from the natural environment, guys, where it used to usually live. So it has left those environment. Then coming on to the adaptation, guys. So we have hypertrophy, hyperplasia, guys. Okay, so basically increase in size, increase in number, guys. These are hypertrophy, hyperplasia, guys. Atrophy when you don't use it. So what are the transcription factor for hypertrophy, guys? This is GATA4, NAFAT and MEF2, guys. This was a previous GT marrow question, guys, if you had solved. Then gravid uterus, guys. So gravid uterus shows hypertrophy more than the hyperplasia, guys. Okay. Then breast puberty, guys, remember puberty, hyperplasia, pregnancy, hyperplasia, lactation, there comes the T, so there is hypertrophy. If there is proximal to the obstruction, guys, you have hypertrophy like bladder BPH, guys. Okay, then bodybuilders will show hypertrophy of the skeletal muscle. Endometrium hyperplasia is due to the estrogen, guys, but prostate ka hyperplasia is due to dihydrotestosterone, guys. So as a result, you use 5-alpha reductase type 2, guys. Finasteride is used for treatment for BPH, guys. Mechanism of atrophy, guys, that is due to ubiquitin proteasome pathway. Metaplasia is due to reprogramming of cell death. The classical example that you see, the Barrett's esophagus, guys, where it gets transformed to epithelium gets changed, guys, to adenocarcinoma. So most common metaplasia is the squamous metaplasia, and this vitamin A is associated with metaplasia. Hallmark, guys, of Barrett's esophagus is the goblet cells, guys. This was again a PYQ, guys. Which stain does it take? So it is Alcian blue positive. If you have look at the images, guys, you see the presence of glands here, guys. And mesenchymal metaplasia means myositis ossificans. Basically, the fibrous tissue gets converted into muscle, gets converted into a bone. Then coming to autophagy, guys, as the name indicates, phagy means auto means self, that is self-eating. It is also known as cannibalism, self-cannibalism. So the scientist who received the Nobel Prize is Sir Yoshine Rosumi, guys. Okay, so he received the Nobel Prize for his mechanism. So what is the gene involved, guys? That is ATGS1 gene, and ATGS5 increases the risk for your tuberculosis, guys. Okay, and marker for autophagy is the LC3, that is a light chain 3, and this is seen in your old age, malnutrition, cancer, neurodegenerative disorders, guys. Then coming on to the special stain that you read in entire path, guys. Okay, so melanin, guys, you have two stain. One is the Mason Fontana stain, guys. Okay, and one is the Scomol stain, where you see the blue green color. So this Mason Fontana, guys, okay, is black in color, guys, and that Scomol stain is blue green in color, guys. Okay, so be sure, guys, if there is melanin in the brain, guys, basically what does it takes checks the substantia nigra, guys. Okay, that is important, which we tells there is a deficiency of dopaminergic neuron in the substantia nigra pars reticulata, guys. Okay, that is again important. Then hemosiderin composition, guys, it's form of iron. Heme, you see in the name is only there. So hemosiderin special stain is the Prussian blue stain, guys. Lipofusion, guys, so basically this is seen in old age, so senile atrophy, lipochrome. So there it looks like a perinuclear pigmentation is there, guys. Okay, that, and you will have typical history of 80-year-old male, 85-year-old male, something like this, guys. Okay, they give you the lipofusion, guys, special stain, guys, is oil red, guys. Okay, and telltale sign of free radical injury, that is your lipofusion accumulation. So copper stain, guys, you have rhodamine and rubanic acid. Copper ends with R, and you have two stain, that is rhodamine and rubanic acid. Then triad of Wilson disease, guys, basically you will have effect on the liver, guys, that causes cirrhosis. Then see, first of all, Wilson disease is ATP sun beta, that is 7B gene mutation, and ATP7A is the Menkes disease, guys. Eye, you will have the presence of Kasher-Fleischer-Ring in the eyes, and brain, it will have involvement of putamen. Hence, this Wilson disease is also known as hepaticulolenticular degeneration. Again, important PYQ. Then coming on to next one, guys. This anthracotic, basically coal wala pigment, that is black in color, koila. Then hematin pigment is seen in malaria. Homogentisic acid, guys, seen in alkaptonuria, that is alka, that is kala color urine, black color urine, guys. Okay, where you have deficiency of enzyme homogentisic acid oxidase. Now coming on to the lipid, guys, that is oil redo, Sudan black bee, and osmium tetroxide. These three are the see, you can see the color red, guys. Stay in use in frozen section is your oil redo. This is also a PYQ. Then coming on to the protein, guys. So this protein misfolding is done by the chaperones, and misfolded proteins cause ER stress. And Russell's body, this are seen in, guys, this is seen in multiple myeloma. This Russell body, Dutcher body, and the Mott cells. So this Russell body are seen DNA. Remember, DNA is inside, guys. Dutcher intranuclear, and Russell RNA normally outside. Remember, cytoplasmic. Then Mallory hyaline body, Mallory drink body, guys. Okay, this is seen in alcoholic hepatitis. And the composition is cytokeratin 8 and 18. This is again a PYQ, guys. Okay, now coming on to the glycogen, guys. Okay, so glycogen seen in glycogen storage disorder, diabetes mellitus. Okay, so that is PAS positive, diastase sensitive, guys. Again important. Now coming on to calcium. If the calcium is present in dead and decaying tissue, that is a dystrophic calcium. So here the serum, since it is dead tissue, guys, serum calcium levels will be normal. Okay, then if it is in normal tissue, that is your metastatic calcium. Serum calcium level increase in your metastatic. What's normal wala tissue? Mockenbug sclerosis. Do you see, guys, there is a blue color inside the wall of the artery. So this is an example of dystrophic calcification, also known as calcified medial degeneration. Then a special stain for calcium. The West stain is the von Cosa stain, guys. Okay. Then alizarin red is for minute amount of calcium, guys. Okay, remember like this, ZARA means jarasa calcium, that is minute amount of calcium. Then calcium, name will indicate it will go for calcium. So how does it appear, guys? On gross, the one which we see in the fat necrosis, guys. Do you remember? It appears chalky white in color. HNE, guys, this appears blue in color, means basophilic appearance. And von Casa, guys, if you look at this image, guys, that is black in color. Then coming on to the Samoma body. So remember from this name only, guys. P for papillary carcinoma, S for serous ovarian tumor, M for meningioma, M for mesothelioma, P for prolactinoma, guys. Okay. Most common site of metastatic calcification is the lungs, guys. And first organ for calcium deposition is the mitochondria, except the kidney, where the first organ is the basement membrane, guys. Now coming on to the cellular aging history, guys. Okay, so the most expected theory is due to the free radical VAs, and second most is due to the shortening of telomere. And we have a sequence of telomere, guys, that is TTAGGG. And telomerase is maximum in the actively dividing cell, that is a germ cell. Telomerase is also known as immortality sin, because if the telomere do not shorten, you won't age. Then sirtuins are increased by increasing the insulin sensitivity, guys. This was also a PYQ that has been tested upon, guys. Okay, so how can you increase the level of sirtuin, guys? Okay, so basically that is by calorie restriction and red wine ka consumption. So this has a role in ACD, that is aging, cancer, and diabetes. Then you have Werner syndrome and Wermer syndrome, guys. So this Werner syndrome is the premature aging, guys. That is the progeria. Okay, and this Werner syndrome is the man 1 syndrome, guys. Okay, we have I have included all the man 1, man 2A, man 2B syndrome, guys. Okay, I have included, this is due to the meninvalazine, so I have included, it will come, guys. Then free radical. So we can have peroxide, H2O2, hydroxyl ion. Okay, most powerful is the hydroxyl ion. So you have Fenton's reaction, guys, where ferrous is converted into ferric form, which in turn leads to the conversion of hydrogen peroxide to hydroxyl ion. So protective, guys, you have vitamin A and E, and vitamin A is not protective in the vitreous humor of eyes. So there is a protective enzyme that is known as SOD, that is superoxide dismutase, guys. Okay, and most important in the brain, guys, that is the catalase enzyme. And SOD1 gene mutation, guys, that is seen in amylotropic lateral sclerosis. Remember, guys, this is a both combination of upper plus lower motor neuron. This can be again tested in your exam, guys. Okay, then see what we have read about the intrinsic pathway and the extrinsic pathway, guys. Extrinsic pathway, we said that there is a factor 8 activation because 10 is not seen, guys. Okay, so here you have a factor 9 activation, guys. So one thing, this is also important, this is SMAC or Diablo. Okay, so basically this is a physiological inhibitor of apoptosis that may be asked as an MCQ, guys. Okay, so this we have already seen, stress sensor, bim bid bad puma noxa. Okay, and BCL2L is there, means decreasing anti-apoptotic, and backs BCL excess. Okay, they are pro-apoptotic molecule, which leads to the execution caspase, that is 3, 6 and 7, and which will lead to the cleavage, guys, at the 180 to 200 base pair, leading to the step ladder pattern and leading to nuclear chromatin condensation, which is the hallmark of apoptosis. So this entire apoptosis is done, guys. Moving on to the next one, guys. Okay, so moving on to the next chapter, inflammation per se, guys. Okay, so see, this is Werner, that is premature aging, that is known as progeria. Okay, and Werner is your Mann-Wanga syndrome. Then coming on to, guys, coming on to the cells, guys. Okay, basically this is very important, one of this is very frequently repeated, guys. Okay, see, brain you have glial cells in the brain, guys. Okay, glia, okay, astroglia, you can remember like this. Lungs, you have macrophage, okay, and lungs trap the dust, so dust cells. Liver, guys, you have the Kupffer cells. Spleen, you have the littoral cells, guys. Okay, because spleen is where all the RBCs go and die, guys. Okay, so like a littered place. Kidney, mesangium is there, so mesangial cell. Then placenta, guys, you have Hofbauer cells. Bone, that is your osteoclast, and synovium, that is your type A synovial cells. Now moving on to the next chapter per se, that is your inflammation. Okay, so what are the cardinal signs of inflammation? You have rubor, redness, Calor, increase in temperature, Dolor, pain, tumor, swelling, and functional ulcer. This was the last sign that was added by your Rudolf Virchow, who is known as the father of path, guys. Okay, and these 4 signs were given by the Celsus. Okay, so what are the contribution of Rudolf Virchow to the field, guys? He is known as the father of modern path. He coined the term cellular path. The Virchow's lymph node that you hear, guys, okay, left supraclavicular lymph node, that is again name. Then Virchow's spore and the Virchow's strides, guys, that include hypercoagulative, vessel injury, and thrombosis, guys. Okay, then coming on to the acute and chronic inflammation, guys. Acute when it is short-lived, guys. So what are the cells of acute inflammation? That is your neutrophil. Exception, there is thyroid, guys, where you have relative lymphocytosis, guys. Chronic, you have lymphocyte, monocyte, macrophage, plasma cells, guys. Exception, chronic pseudomonas, guys, where you have neutrophil. Now coming on to the classification, guys. Okay, you can have serous inflammation. Serous means watery. Fibrinous means fibrin-like, guys, like thread-like. Then purulent, guys, purulent, pus-like. And catarrhal, that is water plus mucus, guys, which is seen in common cold. And most common is the cattle. C for cattle, C for cold. C for coagulative, C for most common necrosis, guys. Okay, C for cattle, C for most common type of fluid. Now coming on to the vascular event of inflammation, guys. Okay, so see, first of all, immediately what happened, there is a transient vasoconstriction followed by the vasodilation, guys, which leads to the increased vascular permeability. Okay, as a result, there is stasis, which is the hallmark, guys. Then what is the mediator, guys? Histamine is the mediator, and maximum permeability is seen in the venules, guys. So what happens? So also there is a mechanism of permeability that is due to endothelial contraction, which is the immediate and transient event. And when there is a direct injury, guys, okay, that is delayed, okay, delayed and prolonged, guys, DP. When there is a direct injury, that was mild. If there is severe direct injury, guys, severe, that will lead to sustained, okay. Leukocyte mediated, if it is, that is delayed and prolonged, guys. Then you have transcytosis, guys, that is due to vesico-vacuolar organelle, guys. Okay, and angiogenesis mediated, guys, formation of new blood vessel, that is due to vascular endothelial growth factor and the histamine, guys. Now coming on to the sequence of inflammation, guys. So remember the mnemonic AMRAT-COP, guys. Okay, that is your margination, rolling, adhesion, transmigration or diapedesis, guys. Then you have chemotaxis, opsonization, and phagocytosis, guys. That is your sequence of event. Now coming on to the first cellular event, guys, that is your margination. So normally the blood flow is lamellar blood flow, more in the center, guys, and less in the periphery. So cells following the center most are the RBC, guys, and you have molecules for rolling, guys. Okay, that is your selectin, guys. So we have 3 types of selectin, guys: P selectin, E selectin, and L selectin, guys. Okay, and these are basically CD62 molecule, guys. Okay, and what is the other function? That is homing, guys. So see, you have P selectin, E selectin, and L selectin, guys. This is the endothelial cells, guys. Okay, and this is your CD34, that is your stem cell ka marker, guys. Okay, here you have Swile-Lewis antigen on the WBC, and this is the L selectin present on the WBC. P selectin and E selectin are present here. So coming on to the next one, guys, that is Bevel palate body, guys. If you see W, you can make into V, guys. Pallid is your p-selectin, guys. Okay, so that is again important, they ask you, guys. Okay, so they are located in the endothelial cell. The marker is CD34. So molecules for adhesion, guys. Okay, so adhesion you have, guys, integrin, guys. Okay, adhesion for rolling, guys, you have selectin. Okay, rolling you have selecting, you roll and select, and for adhesion you have integrin, guys. Okay, because you need to adhere, integrate, guys. Okay, so you have integrin. So type of integrin, guys, we have two type of integrins. One is beta 1, that is also known as VLA, and beta 2 known as CD11 CD18, guys. See, this is beta 1, this is beta 2. Okay, also known as VCAM. Okay, now coming on, guys. See, we have done beta 1 and beta 2, guys. Okay, now see, now coming on to transmigration, also known as diapidiasis. Basically the movement outward, guys. Okay, that is movement outward. That is molecule is CD31 or PCAM31, guys. This is again a PYQ, guys. Okay, enzyme is matrix metalloproteinase. So chemotaxis means going towards a unidirectional targeted direction, guys. Movement of WBC towards the bacteria due to chemotactic agents, guys. This is due to G protein coupled receptor, guys. So it can be exogenous or endogenous, guys. Exogenous is due to the bacterial product, guys. Okay, endogenous is due to LIC, LTB4, leukotriene B4, interleukin 8 and the C5A. Then opsonization, guys. Okay, basically opsonization means having a coating over it, guys, so that it tastes good, guys. Okay, that is, it is not mandatory, guys. Example, it can be done with IgG, C3b, C4b, C5b, guys. Plasma protein can also done. Best opsonin is the IgG, guys. Okay, then best complement opsonin is the C3b, guys. Okay, C3b is the best one. Now phagocytosis ka scientist who discovered it, guys, it was discovered by Sir Ilya Metchnikoff, and there are three steps in phagocytosis, guys. The last step in the Metchnikoff. So you have recognition, attachment, engulfment and killing, guys. So for recognition you have scavenger receptor, mannose receptor and opsonin receptor, guys. It can be either oxygen dependent killing or maybe independent killing. And oxygen dependent killing is the more potent method, that is hydrogen peroxide, MPO and halide method, guys. Okay, and most important is, and this is again important, NAPDH oxidase. And final end product is the hypochlorous acid, that is your bleaching powder. MBP, guys, MBP stands for major basic protein and source is eosinophil, guys. Okay, this cathepsidin decrease the risk of TB, guys. Okay, and it depend on vitamin D. And also we read ATGS5 increase the risk of cancer, autophagy wala, and LC3 was the marker, guys. So this is important, this vitamin D deficiency increases the risk for TB, guys. Okay, then next, guys, that is neutrophil extracellular traps, guys. Okay, so basically this is the beneficial suicide here, guys. What is the amino acid essential? That is arginine. It is associated with autoimmune diseases like SLE. At the end of next, guys, neutrophil down. So see, basically it has given everything out in order to go and engulf it, guys. Chromatin come out to form a trap, guys. Then emporyolasis, guys, that is cell within a cell, guys. Okay, so here guys, it remains intact instead of being killed, guys, as in phagocytosis. So example, guys, you have MDS, guys, myelodysplastic syndrome, then Rosai-Dorfman disease, and you have autoimmune hepatitis. Then coming on to the LAD, guys, that is leukocyte adhesion defect, guys. So you have LAD1, LAD2, LAD3. LAD1, guys, the important thing, there is a problem with I for integrin, guys. Remember beta 2 integrin, that is 11 and 18, guys. Remember this. Then coming to LAD2, guys, that is CLI-Lewis antigen ka defect, again important. Okay, and here you find a history of delayed separation of umbilical cord, guys. Okay, and here you have a history of Bombay blood group. Again, these two are very important clinical hint, guys, and all of this LAD are autosomal recessive, guys. See, this is delayed umbilical cord separation and this is Bombay blood group, guys, already discussed. Then coming on to the Bruton as the name indicates, hypogamma globulin, there is a decrease in production, guys. So remember, B for Bruton, B for boys, B for BTK, Bruton tyrosine kinase gene, guys. B cell ka defect hai, and there is a defect in opsonization, guys. Then coming on to Chidiac-Higashi syndrome, guys. Okay, so this Chidiac-Higashi syndrome is the autosomal recessive disorder. Here you have a Lish gene ka defect, guys. C means CNS abnormality. Then guys, H means hemostasis or platelet defect, guys. DI means decreased immunity. A means albinism. So guys, there you can see oculocutaneous albinism, guys. Okay, and this shows the presence of a large granules, guys. Okay, normally shows large granules. Then CGD, chronic granulomatous disease, guys. Okay, So that can be autosomal recessive or X-linked, but X-linked is more common, guys. Okay, so see, you have autosomal recessive and X-linked. There is a defect in NAPDH oxidase, guys. Okay, so remember, guys, we can have either GP47, GP67, or we can have GP91, guys. So how to remember? 9 plus 1 is 10, guys. Okay, and X-linked is 10, guys. X is 10. So you can remember, don't confuse. GP91 is X-linked recessive, but autosomal recessive is GP47 and GP67, guys. Okay, then the biggest problem here is there is a infection with increased infection with catalyst positive, guys. So what are the mnemonic for catalyst positive, guys? That is a no space, no for nocardia, S for S aureus, guys, P for pseudomonas, guys. Okay, A, pseudomonas aeruginosa, C for candida, guys, E for enterobacteriaceae like E. coli, guys. And this was again a question in yesterday's Marrow GT, guys. Okay, in Marrow GT 13, it is nitro blue tetrazolium test, guys. Okay, and if there is a myeloperoxidase enzyme deficiency, there is the infection with both catalyst positive and catalyst negative. Then histamine, guys. Okay, the scientist was Sir Thomas Lewis, guys. So it's secreted from the mast cell, basophil, guys. Okay, and plasma and platelet, guys. Okay, richest source is the mast cell, guys. Ma is the richest source, guys. Okay. Then the precursor is the histamine is formed from the histidine molecule, guys. Function: histamine will cause vasodilation, increase vascular permeability, bronchoconstriction, like the same thing which happened in asthma, guys. There also histamine is there. Serotonin का precursor is tryptophan, guys. It is released from platelet. Richest source is the EC cells, that is the enterochromaffin cells, guys. Function: histamine के according similarly. Then lysosomal enzyme, guys. This is again important. So you have basically granules, guys. Okay, primary granules, secondary granules, and tertiary granules, guys. Okay, so see, this tertiary granule is the C particle. C is the third letter, and C you can make into a G. That is your gelatinous. Now coming on to the secondary wala, that is a lactoferrin, lysozyme, guys. Then type 4 collagenase, guys. Okay, this is again important. Then coming on to the next one, guys. Then it is the acid hydrolase, guys. Okay, then you have C for collagenase, guys. Okay, E for elastase, D for defensin, M for MPO, guys. This primary granules are known as the azurophilic granules, guys. Okay, secondary granules are the specific granules, guys. Okay, so lactoferrin, lysozyme, and your type 4 collagenase, and tertiary granules are the C particle, that are the gelatinous, guys. Okay, then coming on to the nitric oxide, guys. The precursor is arginine, and the enzyme is nitric oxide synthesis. So you have IENOS, EENOS, and NNOS. I for inducible, E for endothelial, and N for neuronal, guys. Function: vasodilation and microbicidal. So you have platelet activating factor, that is phospholipid derived, guys. Okay, then coming on to arachidonic acid metabolites, guys. Precursor is the phospholipid, enzyme is the phospholipase A2. So number of carbon is 20, guys. We have COX1 and COX2, guys. COX stands for cyclooxygenase. So you have PGI2 and TXA2, guys. Okay, if we talk about your PGI2, guys, that is prostaglandin I2, guys. That is PGI2. Remember, I2, that is inhibits platelet aggregation. A2, guys, that is promotes platelet aggregation, guys. Okay, source is endothelium for PGI2. For thromboxane, the source is platelet. PGD2, guys, that is the vasodilation. PGE2, that is your fever and pain, and PGF2 alpha is your smooth muscle ka contraction. Then coming on to the LOX, that is second wala pathway, cyclooxygenase done, lipoxygenase. So we have 5 LOX, 12 LOX, guys, and this releases the leukotrienes, guys. LTB4, guys, already read in chemotaxis, we had LIC, guys. Okay, that was LTB4. Then LTC4, D4, E4, also known as SRA, that is slow reacting substance of the anaphylaxis, guys. So as a result, we use a leukotriene receptor antagonist like as montelukast, guys. Okay, because they cause bronchoconstriction, and we need to prevent it, guys. Okay, then you can have cytochrome P450 apoxygenase, guys. So you have EET and HETT. These are antihypertensive, guys. Then we can have isoiconoside, guys, isoprostanon, which is used for vasoconstriction. Now COX inhibitor is the aspirin, which inhibits both COX1 and COX2, as a result leading to peptic ulcer. Selective like celecoxib, guys, which are selective COX inhibitor. Then LOX inhibitor, guys, that is lipooxygenate, guys, inhibitor. LT receptor antagonist is the montelukast or jafelukast, guys. And phospholipase A2 inhibitor, that is the steroid. Now coming on to the cytokine, guys. Okay, one question will be pakka there from this cytokine in any exam that you are going, guys. Okay, see, first of all, that is most important is the TNF alpha, guys. Fever, that is pyrogenic, that is interleukin 1. All interleukin 1 pyrogenic except interleukin 18. Okay, then most increased appetite, guys, that is alpha. Okay, A for alpha, A for appetite. Most important acute phase reactant, guys, that is your interleukin 6, guys. Okay, pro and inflammatory, that is 4 and 6 are pro and anti. Okay, then coming on to anti-inflammatory, guys, that is 10 and beta, guys. Okay, then most fibrogenic, guys, TGF beta, transforming growth factor beta, that is the most fibrogenic. Eosinophil ka activation, guys, you have interleukin 5, guys. Neutrophil, that is interleukin 8. Antiviral, guys, remember A for alpha, A for antiviral, B for beta, B for brain, guys. So this is used in basically multiple sclerosis. G for gamma, G for granuloma, guys. Okay, then coming on to the positive acute phase reactant and negative acute phase reactant, guys. Okay, so you have, guys, negative is frequently as remember the negative 10, guys. Okay, so transferrin, albumin, transthyretin are they are negative, and for negative, so remaining everything, that is CRP, guys. Okay, then SAA, serum amyloid precursor, then the ferritin, guys. Okay, that is capsular polysaccharide of the pneumococcus, guys, C-reactive protein. Now coming on to the chemokine, guys. Okay, so we have remembered in same sequence, guys, CX3C, then CXC, then CC, then C, guys. CX3C recruits the monocyte, guys. Example, fractalin. CXC, guys, recruits neutrophil, guys, that is interleukin 8, guys. Already done 8 for neutrophil, guys. Okay, then all WBCs except neutrophil, guys, because neutrophil already IL-8 has done, so that is MCP, guys. Okay, eotaxin for eosinophil, then rantis for T cell, MCP for B cells, guys, and lymphocytes, lymphotactin, guys. Then coming on to the complement system, guys. So you have classical pathway, alternate pathway. Classical is due to antigen antibody reaction, that is IgM more than IgG. Alternate is due to microbes and IgA, guys. Most common complement deficiency is the C2, guys. Okay, C1, this is very important, guys, you cannot miss it up. That is hereditary angioneuritic edema. They will show you a image of a lips, that is swollen up. Then C1, C3, C4 deficiency SLE, guys. This is again very important. Therefore, that late complement deficiency cause basically infection with capsulated organism, that also they commonly give disseminated Neisseria infection. Then CD46 factor H or I deficiency, guys, that will cause atypical hemolytic uremic syndrome. Typical is caused due to O157H7, guys, that is again tested. Then CD55, CD59 ka defect, that is, guys, CD55 is FDK accelerating factor and CD59 is MIRL, membrane inhibitor of reactive lysis, guys, that is your PNH, paroxysmal nocturnal hemoglobinuria. Anaphylotoxin, guys, that is C3A and C5A, guys. Chemotactic is C5A, guys, that is done in LIC wala mnemonic. Opsonin, guys, 3A, 3B, 4B, 5B. And membrane attack complex, guys, this is again important, MSC, guys, that is C5B to C9, guys. Okay, now coming on to your clotting pathway, guys. Okay, when we talk about your clotting pathway, so you have extrinsic pathway and extrinsic pathway, guys. Okay, so remember extrinsic pathway, PET, that so extrinsic pathway is the prothrombin time, so intrinsic will automatically come APTT, activated partial thromboplastin time. Okay, guys, then coming on to the next one, guys, total factor you have 1 to 13 except the number factor 6 is not there, guys. Okay, then you have kinin system. Bradykinin will cause pain and increase vascular permeability. So now coming on to the hallmark of chronic inflammation, guys, that is a tissue destruction. Most important cell is the macrophage or the monocyte, guys. So we have M1 type and M2 type. M1 is activated by the classical pathway, interferon gamma will cause granuloma, guys. Okay, they produce interleukin 1, 2, 12, guys. Okay, M2 is with the alternate pathway, that is activated by 4 and 5, guys. Okay, that produces interleukin 10 and TGF beta, that is anti-inflammatory, guys, and this is pro-inflammatory. See, brain, this already has been discussed, guys, all of this macrophage, guys. Then granulomatous inflammation, when you have presence of granuloma giant cell, that is a subtype of your chronic inflammation. So you can have necrosis, macrophage, modified macrophage, epithelioid cells, giant cell, guys, which are formed by the fusion of macrophage. So most important cell of the granuloma is your epithelioid cells, guys. Okay, nucleus of this epithelioid cells appears slipper shape, guys. Okay, see, this is the lymphocytic collar. If you look at the image, guys, this is the lymphocytic collar, guys. Okay, this is the caseous cheesy necrosis, guys, and this is the epithelioid cell which are slipper shaped. Okay, coming on to the TB, most common caseating granuloma, also may be seen in histoplasma sarcoidosis, which was non-caseating granuloma. Okay, and this is next granuloma because they lack lymphocyte collar. Okay, then coming on guys to the stellate granuloma. This stellate granuloma, do you see the star shaped appearance guys? That is a stellate granuloma that is seen in your cat scratch disease and your lymphogranuloma venerum. Then coming on to the dark granuloma guys, that is seen in cerebral malaria caused by Plasmodium falciparum, and inside you can see this is done with felt stain if you have a blue color guys. Donut granuloma, make a Q out of donut guys, that is Q fever Coxiella bruneti. Then inflammatory bowel disease showing the granuloma guys, that is a Crohn's disease. Now coming on to the all the various giant cells guys that may be tested in your exam. Langerhans giant cell, remember guys, that is Langerhans, not Langerhans guys. Most of the students may make this mistake guys. Okay, Langerhans cell is seen in TB guys, that is a horseshoe shaped nuclei guys. Okay, then Tauten giant cell guys, that is seen to you in your xanthoma guys. Tauten, okay, that is your wreath like nuclei with foamy cytoplasm. Then foreign body is seen in your suture or talc material guys. Okay, then Warthin-Fingaldi guys, this is so frequently repeated guys. This is W ka ulta if you do guys, that is M. So this is seen in your measles. That shows the presence of 3C Kupford as a conjunctivitis guys. Here you have both intranuclear and intracytoplasmic inclusion. Then coming to RS cell, Reed-Steinberg cell, that is CD15, CD30 and PAX5 positive guys. Again this is very important. Okay. That is seen in your Hodgkin's lymphoma owl eye appearance guys. This owl eye appearance guys is also seen in your cytomegalovirus. But if you see this Reed-Steinberg cell Reed guys, okay, so here you see the presence of eosinophilic material guys. If you see the basophilic material guys, that is your basically cytomegalovirus infection. Then coming on to this wound healing guys. Day 0 you have fibrin and platelet. Day 1 neutrophil and blood clot will come. Day 2 you will have normal blood clot and thin epithelium guys. Day 3 important guys because you have macrophage and granulation tissue guys. Okay, and the hallmark of healing is the granulation tissue, and it is composed of newly formed blood vessel, proliferating fibroblast and inflammatory cells guys. This image may be tested upon. Then collagen guys. Okay, so you have collagen type 3 guys, and one is present in bone and 3 in blood vessels and other thing. What is the vitamin for healing guys? C. Okay, vitamin C. Metal is the zinc one. Wound strength guys, this is very important. They frequently ask you this. At the end of 1 week it's 10%. At end of 12 weeks it's 70%. 100% is never. Most common cause of decreased healing in the is infection guys. Then coming on to excessive granulation tissue guys. Okay, so that may be proud flesh. If there is increase in scar, that is keloid and hypertrophic scar. Okay, so coming on to the most common side of keloid guys, that is the sternum guys. Okay, so what happens then in keloid and hypertrophic scar guys, it does not cross the boundary of the wound, and keloid grows much more than the boundary guys. Treatment here for keloid is the intralesional steroid, that is the triamcinolone guys. Okay, and it has a genetic predisposition, so it is bound to occur after any surgery or something. If you look at the keloid guys, you have thick collagen fiber, and if you look at the hypertrophic scar guys, you have orderly arranged fibers guys. Okay, see ORT, that is orderly arranged fibers. Now coming on to the stain in one page guys. Okay, see we have already done. We'll see guys something left guys. When we talk about path, hematoxylin and eosin, HNE cannot be stained. Then eosin guys, that is pink and acidic. Oil red already done for fat. Sudan black we already done guys. Pass stain for glycogen, basement membrane, fungus, lymphoblast, erythroblast. Von Casa most commonly for calcium. For a small amount of calcium guys, that is alazarin, zarasa calcium. Prussian blue, that is your iron or hemosiderin. GMS, Gomri, methamine, silver means it will appear black guys. Okay, pass stain. Okay, periodic is acid escape stain, that is fungus ka stain. Acid fast guys, mycobacterium, TB, lepra, nocardia. Mason Fontana guys already done for melanin guys. Mason trichome guys, if you see tri means 3, there are 3 color. Muscle is red guys. Okay, collagen is blue guys, and nucleus is blue black in color guys. Okay, then rhodamine guys, copper, rhodamine and rubanic acid. Toluidine blue stain the mast cell guys, this is again a PYQ. Then DNA serves as the fuel guys, so DNA is the fusion stain. Hall's stain is the bilirubin guys, but Hall's criteria is for Down syndrome diagnosis. Warthin-Starry is for Helicobacter pylori guys. Okay, so this is a photo which I have tried to demonstrate all the image guys. Okay, see I am zooming it. With this we have already discussed in one of the previous 20th notebook guys, so we won't be discussing again guys. Okay, so I'm showing you the image, you can have a look guys. Okay, now coming on to the next one guys. Okay, now coming on to the next one, some important immunohistochemistry marker guys. Okay, see this is some important immunohistochemistry marker. So we are doing some basic stuff guys, then we'll go to the basically the topic of your inflammation wala or the dreaded table wala thing will cover it now only, don't worry guys. Okay, see, squamous cell carcinoma of the lung guys, that is P40 P63 positive, don't miss it out. Small cell is a guys, small cell is a neuroendocrine tumor guys. So all these neuroendocrine tumor are positive for synaptophysin, chromogranin, bombacin and P40 P63 guys. Adenocarcinoma of the lung, TTF1 or napsin A guys. A is the first letter, 1 is the first letter, napsin A is the first letter guys. These notes are credit to guys Dr. Nidhi guys, who got a very good rank. It's her notes. So epithelial source carcinoma, that is the cytokeratin. Mesenchymal origin guys, that is vimentin. And muscle and sarcoma, that is the desmin. Smooth muscle acting, that is leiomyosarcoma. And MYOD1, that is rhabdomyosarcoma. And factor 8 guys, that is angiomyosarcoma. So you have some resistant tumor guys, that is HOMP, H for HCC, RCC, O for osteosarcoma, M for melanoma, P for pancreatic tumor. See, out of this CK7 and CK20 guys, one will be definitely asked in your NEET PG, INSCT, FMG. Maybe they can ask you because this has been tested in NEET PG and INSCT guys. See, both positive if you look guys. Okay, so remember both positive. 1 minute guys. Okay, let me zoom it out a bit. Both positive guys. Remember the bladder cancer guys, bladder cancer is both positive guys. Okay, also this is ovarian cancer guys. Okay, this is important that you need to know. Then coming on to CK7 guys. Okay, so remember this females have 7 letters, so they are CK7 positive guys. So see, basically you have mode of female cancer: endometrial carcinoma, cervical carcinoma guys. Okay, breast carcinoma. Okay, also you can have lung or thyroid carcinoma guys. Okay, so that is important. Now coming on to CK7 negative, but it is 20 positive guys. At 20 you can become the chief minister guys. So that is colorectal cancer, M for Merkel cell carcinoma. Then both are negative guys. Okay, so so the HR under whom you work guys, okay, they think that people are useless. So that is hepatocellular carcinoma and renal carcinoma guys. Now coming on to some important guys, this is taken from your first aid book, that is GFAP, glial fibrillary acidic acid protein. This is positive in your glioblastoma. Neurofilament seen in neuronal tumor like neuroblastoma, which shows the presence of opiosclonus myosclonus. PSA, prostate specific antigen guys, name will indicate prostate cancer. S100, which is basically seen in neural cancer, melanoma, schwannoma and Langerhans cell, which shows S100 also positive, CD1A positive and CD207 positive. Trap, that is tartrate acid. So basically hairy cell, hair get trap, remember like this guys. And annexin A1 is the marker. Okay, coming to some other marker, CD99 or mixed 2, that is Ewing sarcoma guys. And wings help you fly, that is EWS-FLI1. Okay, melan HMB45 SOX 10 guys, that is your melanoma. Okay, now coming on to some other basic here and there stuff. Okay, that is TB ka foci guys. So Ghon's focus, that is primary focus in the subpleural parenchyma. Ghon's complex, that is focus plus lymph node ka involved. Rinkies guys is the calcified ka nodules. Okay, calcium ka focus. Then remember SPA, Simon, Pulse and Asman guys. Okay, Simmons, that is guys, Simon is in liver guys. Brain is rich in information, so brain is meninges. And VGAT is the pulmonary vein guys. Okay, so see, Simon, first is the apex guys, then supraclavicular. So first of all guys, you have the apex of the lung guys. Okay, then you have the supraclavicular, then you have the infraclavicular. You can remember like this guys. I think it's very easy now. Okay, you won't confuse it. Now coming on to the important tumor marker guys, that you will read all across in your entire path. See, beta HCG guys, remember H for H mole, hydrity form mole, C for choriocarcinoma, G for gestational trophoblastic cancer. Then alpha fetoprotein guys, two things that you must remember. One is the hepatocellular carcinoma, one is the yolk sac tumor, also known as your endodermal sinus tumor, which shows the presence of ciliar dual body. We'll see the image afterward. Then calcitonin guys, medullary carcinoma of thyroid, very very important. PSA, prostate wala sara thing, that is prostate carcinoma. NSC, chromogranin, all the neuroendocrine tumors like the small cell carcinoma guys. Then coming on to the KRAS guys, that is positive in Kapil ka tumor. KRAS, remember Kapil, that is your, so sorry guys. Okay, that is your KRAS is your basically Kapil wala tumor guys, that is colon cancer, pancreatic cancer and your lung cancer guys. Okay, then CA125 is in ovarian guys. CA15 3 you can make into a B guys, that is breast cancer. CA72 4 guys, that is your stomach cancer guys. Okay, so and that is your 1999. If you turn it out, that turns out to be a P, that is your pancreatic cancer. Okay, seeing some of the immunodeficiency disorder guys. See, Viscott Aldis. So the important thing that you need to remember guys, Viscott basically history of bleeding from the umbilical stem guys. W, if you reverse it out, so there is a low IgM guys, and there is a wasp gene defect. So remember tie a wasp, that is thrombocytopenia, infection and eczema. Then cardiac acid. We have already done CNS problem, hemoptysis, defective immunity, giant granules in the platelet, guys. Okay, and list gene defect, guys. Okay, again done. Okay, then you have leukocyte adhesion. We have already done, guys. Chronic granulomatous already done. Then coming on to the next very important thing, that is your Dye-George syndrome, guys. So that is catch-22. Okay, so catch-22. C for cleft lip or palate. A for abnormal feces. T for thymic hypoplasia. C for cardiac defect. H for hypocalcemia. Very very important, guys. There is a deletion of 22q11, that is TBX1 gene, guys. Okay, very important. See, this is a summary table. Viscotalis wasp gene ka defect, inheritance X-linked recessive, hyper IG also known as Job syndrome, guys, where you have STAT3 ka deficiency, not so important. Cardiac is important, least gene, guys. Chronic granulomatous disease, NAPDH oxidase, maybe X-linked recessive or dominant, guys. If it is X-linked, that is GP91 and this is GP4767, guys. Okay, then LAD, guys, leukocyte adhesion defect, guys, that is if there is type 1, guys, that is due to integrin, guys. Okay, then BTK, Bruton tyrosine kinase, guys, X-linked recessive disorder, and you have absent germinal center, guys. Then you have SCID, that is severe combined immunodeficiency. The first case it is a case of baby, guys, that is due to deficiency of adenosine diaminase, ADA. Okay, Dye-George, guys, already discussed. Microdeletion 22q11, TBX1 gene, and thymic hypoplasia, catch-22, hypocalcemia, guys. Okay, so this necrosis ka table has been already discussed, guys. You just have a look at the image, guys. Okay, so basically this is eosinophilia ghost cell. This is basically liquefactive necrosis. This is your cheesy necrosis, guys. Okay, this is basically this D1 basically is your calcium ka deposition. I said on HNE it appears blue, guys. Here this is fibrinoid necrosis, and this is your gangrenous necrosis. You have dry gangrene, wet gangrene, guys. See this calcification has also been discussed, guys. Okay, dystrophic dead tissue, metastatic normal tissue, guys. Okay, and here dystrophic calcium levels is normal, guys. Here the calcium levels are usually elevated. Lipofuscin is a wear and tear pigment associated with aging, guys. Okay, so basically here what you see, there is a perinuclear pigment deposition, guys. Next, coming on to the other highly important topic that gets repeated so frequently, guys, that is your amyloidosis, guys. Okay, so basically amyloidosis refers to the presence of amyloid deposition, guys. Okay, so there is a abnormal aggregation of protein into the beta plated linear sheath, guys, that leads to the damage, guys. Okay, so see, what happens on on non-polarized light, it appears red or orange, guys, but in the presence of polarizing microscope it shows apple green birefringence, guys. Okay, that is important. Then coming on to in plasma cell disorder, that is AL, guys. L for light chain, guys. Okay, then you can have other things, guys, that is hemodialysis related, that is A beta 2 amyloid, guys. Okay, then in chronic inflammatory disease, guys, you have SAA, that is serum amyloid A, guys. Okay, then localized, guys, that is beta amyloid is there, guys. Okay, then that is cleaved from amyloid precursor protein, guys. Then type 2 diabetes, guys, that is isolate amyloid polypeptide. Medullary thyroid carcinoma, guys, that is your calcitonin. Okay, then you can have, guys, this systemic senile that can be transthyretin time, not so important, guys, that is your mutate transthyretin, and one is the ATTR, guys. Okay, that is familial amyloid, that is again other thing. So see what happens in amyloid, guys, there is an extracellular deposition of the abnormal protein, guys. Okay, which are resistant to the protease, guys. Okay, so there is systemic thing, that is primary amyloidosis, AL valacin, that is seen in multiple myeloma. Most common organ is the kidney, guys. Okay, secondary amyloidosis, that is AA type, guys. Okay, that is basically seen in the inflammation, guys, inflammatory interleukin 1-6, guys. Okay, that is again important. Dialysis, that is A beta 2. Okay, Alzheimer, we remembered A beta precursor amyloid. Type 2 AI, that is isolate associated amyloid polypeptide. Medullary carcinoma, ACAL, guys, calcitonin is the tumor marker, guys. Okay, then if you have a systemic senile amyloidosis, that, guys, that is age related, so you have basically tera jaake ATTR, guys. Okay, and familial, you have mutated, guys. Okay, mutated transthyretin. In family is only mutated, guys. Due to old age, guys, that is normal or wild type, guys. Okay, most common organ affected is the kidney, guys. Okay, that is important. Then site, guys, it can involve, see, this is important, spleen, guys. Okay, if it involves the red pulp, guys, red, guys. Okay, that is lardaceous spleen. White pulp, that is the sago spleen. In liver, the first site to involve is the space of DC. Okay, skin, it can involve the subendothelial blood vessels leading to pinch purpura, guys. Nerves leading to carpal tunnel syndrome, guys. Diagnosis, this is very important. Abdominal fat aspiration much more than the rectal mucosal mucosa. On macroscopy, guys, this appears vaccine appearance, and on applying lugal iodine, guys, mahogany brown in color. This is the light microscopy, it appears pink, and polarized microscopy, apple green birefringence. Also, this may be methyl violet positive, crystal violet positive, thiophlebin T, guys, positive. Okay, on electron microscopy, guys, there is a non-branching fibrils with indefinite length. X-ray crystallography shows the presence of beta plated structure, guys. This is again important. Okay, now see, coming on to the acute phase reaction. See, we have already talked about the negative acute, that was TAN, guys, transferrin, transthyretin, and albumin. This one of this can be tested upon, guys. Then see, leukocyte adhesion defect and other thing, guys. Okay, see, adhesion, we have adhesion, that is due to the basically integrin, guys. Okay, and this is selectin, guys. Okay, we have already done P selectin, E selectin, L selectin, P selectin from the visual palate body, guys. Dipidiasis transmigration, PE, that is PCAM1, that is CD31, already done, guys. Okay, and chemoattractive factor, you have LTBE4, LIC, guys, interleukin 8 and C5A, already done. Then chronic inflammation, guys. Okay, this Th1 cells, guys, okay, secrete interferon gamma leading to classical wala pathway. Th2 cells, guys, if it activate, that will interleukin 4, 5 and 13, guys. Okay, we read about the two pathways, guys. Okay, that is again important. Then coming on guys, see, this is the basically a pathogenesis where what happens, Th1 cell produces interferon gamma leading to lymphocyte, fibroblast, guys, other things that they have given you, guys. Okay, etiology, mycobacteria, Bartonella, Hensley, cat scratch disease, guys. Then you have Treponema pallidum, histoplasma, guys, cystosoma, guys, other things. Then this is hypertrophic scar and keloid scar, guys. Okay, hypertrophy, if it is well within the boundary, guys. Okay, so there is an increase in type 3 collagen, keloid both 1 and 3, guys. Okay, that is important. It is confined to the border, it is not confined to the border, guys. Okay, and say 70 to 80% of the tensile strength are regenerated at the end of 3 months, guys. Okay, but there cannot be ever 100%, guys. And this excess TGF beta transforming growth factor beta is related to hypertrophic and the keloid scar, guys. Okay, then coming on, guys, to the hallmark of cancer, guys. Okay, so basically you have various hallmark of cancer, guys. So basically a proto-oncogene, signaling molecule, transcription molecule, which is not so important. The thing that is important is the Warburg effect, guys. Okay, so there is a shift of glucose metabolism away from mitochondrial oxidative phosphorylation towards glycolysis, guys. Okay, glycolysis provides rapidly dividing cells, guys. Okay, with the carbon needed for the synthesis of cellular structure. That is important for any cellular structure to form unit carbon, guys, and glycolysis forms the carbon molecule, guys. Okay, so that is important. Then coming on, guys, to this table, that is like a must know, you cannot leave it, guys. Okay, you cannot leave this tumor suppressor ka table and this oncogene ka table, guys. Okay, one of this question will be pakka from this table, guys. Okay, and this carcinogen ka table is also equally important, guys. Okay, something or the other will pakka come, either be it a tumor marker table. So these are all the tables that I have took from your first aid book, so that becomes easy, and also it is concise, guys, so that you can easily remember and recall, guys. Okay, so let's get started with some tables, guys. Okay, so see, ALK, guys. Okay, so ALK is indicated in adenocarcinoma lung. Remember, ALK, lung adenocarcinoma. EGFR and HER2, guys. HER2, everyone knows that is in a breast cancer, guys. Okay, these are receptor tyrosine kinase. EGFR, that is also known as ERBB1, guys. Okay, that is again, one is adenocarcinoma, 2 means breast, guys. Okay, then RET, guys, that is receptor tyrosine kinase, guys. Okay, so this is basically located in MAN2A and MAN2B syndrome, guys. That is very important. Then BCR-ABL, we remember, guys, that is CML, chronic myeloid leukemia, translocation 922. This is a non-receptor tyrosine, and here the treatment was imatinib. Then JAK2, guys, JAK2 is seen in basically your myeloproliferative neoplasm, guys, like your polycythemia vera, guys. Okay, this is again non-receptor tyrosine kinase. Then BRAF, guys. Okay, BRAF is seen in, guys, काफी सारी things. One is the papillary carcinoma, very frequently tested. Hairy cell, very frequently tested, guys. Colorectal cancer. Then c-kit, guys. When you play, you need a kit, guys. Games, guys. Okay, cytokine receptor CD117. So G, A for AML, guys. M for mastocytosis. S for seminoma, guys. All of these are important. Then MYCC, that is CMYC, guys. Okay, that is your CMYC seen in Burkitt lymphoma. neuroblastoma, guys. Can you recall the translocation, guys? Translocation 814 in Burkitt, guys. NMYC, guys. N is seen in neuroblastoma, guys. No confusion. KRAS, Kapil wala tumor, colon, lung, and pancreatic carcinoma. Okay. Then BCL2, guys. This BCL2 is anti-apoptotic. You see L is there, guys, so it will decrease anti-apoptotic. So that is seen in follicular and diffuse large B cell, guys. Follicular is translocation 1418, guys. Okay, now coming on to, guys, loss of tumor suppressor gene, guys. Okay, so basically what happens, there is required damage to only one allele of a proto-oncogene, guys. Okay, so gain of function mutation converts the normal gene are known as proto-oncogene to the oncogene, guys, which increases the risk for cancer. Then tumor suppressor gene, guys. If you have a loss of function, there is an increased risk of cancer, guys. Both two alleles of a tumor suppressor gene must be lost, guys. That is referred to as Knudsen 2-8 hypothesis. This was explained in retinoblastoma concept. Now coming on to the APC gene. APC gene located in chromosome 5q21, guys. Okay, so this is implicated in FAP, guys. Okay, colorectal cancer associated with FAP, familial adenomatous polyposis. Remember F for 5. And this is a negative regulator of beta catenin or WNT pathway. Then coming on to the BRCA1 and BRCA2, guys. Okay, BRCA1 and 2, guys, that is seen in breast, ovarian, and pancreatic cancer. Okay, then CDK2NA, guys. Okay, so that is seen in many cancer, not so important, guys. DCC, guys, that is deleted in colorectal cancer. No confusion, guys. SMAD4, if you remember, guys, this is very important. That is seen in your colorectal cancer, pancreatic cancer. SMAD4 deleted in pancreatic cancer, DPC. Okay, MEN1 menin, guys, that is important. NF1 neurofibromatous 1 located on chromosome 17. NF2 located on chromosome number 22, guys. Okay, that is again important. P10 located on chromosome 10, that involves breast, thyroid, and endometrium, guys. Okay, P can be made into a B, T for thyroid, E for endometrium. RB1 retinoblastoma, guys. Okay, that causes bone cancer, okay, and osteosarcoma. TP53, guys, Leaf-Romanis syndrome, guys. Okay, that is your sarcoma, breast, blood, bones, guys. Okay, then TSC1, that is tuberous sclerosis, guys. Okay, Hamartin. TSC1 is Hamartin, TSC2 is tuberin. So remember, like Hamara Tumara, guys. Okay, so this is chromosome number 9, this is chromosome number 16. VHL is chromosome number 3 and WT1 is 11, guys. So that causes tuberous sclerosis. VHL, guys, that causes von Hippel-Lindau, that is clear cell carcinoma, hemangioblastoma, other things type, guys. And this is Wilms tumor, guys. Then coming on to the aflatoxin, that is seed in stored groundnut and it causes hepatocellular carcinoma. Alkalizing agent like benzene, guys, that causes AML. Okay, that is again important. Then aromatic enzyme like benzidine, guys, this causes transitional cell carcinoma. Okay, then arsenic, guys, that can cause hepatic angiosarcoma. Tobacco, this can cause like so many cancer, guys. Tobacco. Okay, this asbestosis, it causes bronchogenic carcinoma, means adenocarcinoma, and mesothelioma. Mesothelioma is most specific and adenocarcinoma is most common, guys. Okay, this is again PYQ. Ethanol, it can cause squamous cell carcinoma, hepatocellular carcinoma, breast radiation. Radiation, either a leukemia, blood cancer, or a papillary thyroid carcinoma, guys. Then you have radon, guys, that is lung cancer. Then vinyl chloride, guys, leading to the hepatic angiosarcoma, guys. That may be due to vinyl chloride, guys, maybe due to arsenic, maybe due to thorotrust, guys. This is again important that you need to know. Then Epstein-Barr virus, guys. Okay, this Epstein-Barr virus can cause Burkitt lymphoma, Hodgkin's lymphoma, nasopharyngeal carcinoma, NPC. Okay, primary effusion lymphoma. This all the things are Burkitt. Hepatitis B/C, that is hepatocellular carcinoma. Human herpes virus 8, that is Kaposi sarcoma. On the limbs, guys, you will see the presence of reddish patches, macules, guys. HPV low risk 6 and 11 is there. High risk 16 and 18, that causes cervical, penile, anal carcinoma. H. pylori, gastric adenocarcinoma, and maltoma. HTLV, human T cell leukemia lymphoma virus, guys. Adult T cell leukemia lymphoma. Clonarchis cyanins can causes cholangiocarcinoma. Cystosomium hematobium causes squamous cell carcinoma of the bladder, guys. Okay. Then coming on to the tumor marker, this alkaline phosphatase, guys. Okay, so basically this is in Paget's disease of bone, seminoma, guys. That is important. Alpha fetoprotein 6 seen in hepatocellular cancer, hepatoblastoma, Okay, and your neural tube defect, SCG guys, seen in HCG, that is hereditary formal choriocarcinoma and gestational. CA1533 you can make into a B, that is breast cancer. 9 can be made into a P, that is pancreatic cancer. CA125 is the epithelial origin cancer. Calcitonin is the medullary thyroid carcinoma. CA carcinoembryonic antigen guys. Okay, LDH is there, which is seen in seminoma, dysgerminoma guys, other tumor. NSC neuron specific knowledge, that is again seen in neuroendocrine tumor like carcinoid, neuroblastoma. PSA prostate specific antigen guys. Okay, now some important stain guys. Okay, so desmin is for muscle. Okay, so this we have already done guys from here, this table guys. This we have already done from here. Okay, cytokeratin, epithelial cell, desmin for muscle guys. Okay, then samoma body is already done, the mnemonic guys. Okay, cachexia basically weight loss, that is due to the TNF alpha. Then coming on to few most important paraneoplastic syndrome, hypercalcemia guys, that is due to your squamous cell carcinoma of the lung, that is due to parathormone related peptide. Then small cell cancer, remember SLC, small lung cancer. S for SIADH, L for Lambert-Eaton, C for Cushing syndrome guys. Okay, that is again important. Then acanthosis nigricans, this is due to gastric adenocarcinoma. Same with the Lisa Trillet sign guys, they can ask you this. Okay, again important. Then coming on to this thymoma guys. Okay, so it's like a almighty thyma. Okay, all the good thing, that is pure red cell aplasia and the good syndrome guys. Okay, Trautz syndrome is the migratory superficial thrombophlebitis, that is seen with your adenocarcinoma. Also NBT, non-bacterial thrombotic encephalitis. Then this is important, that is opioid myoclonus ataxia syndrome in neuroblastoma in children and small cell lung cancer in adult guys. This is very important. So that was about your first aid wala thing. Now Fragile X syndrome guys. Okay, so basically here you need to remember you have a long face with a large jaw, everted ear, and it is the second most common. The first most common cause is the Down syndrome guys. RB retinoblastoma osteosarcoma. P53 live-Romani. BRCA1 familiar breast and ovarian guys. VHL, that is renal cell. This is a PYQ that has been asked guys. Okay, then coming on to the next one guys, that is your NF1 neurofibromas, NF2 miss me, meningioma, schwannoma. APC guys, basically FAP wala same. PTN breast, thyroid and endometrium. PTCH guys, that is Gordon syndrome seen in basal cell carcinoma guys. CDH1 guys. Okay, that is E-cadherin guys, cadherin 1, that is gastric carcinoma and invasive lobular carcinoma of the breast, which shows the Indian file pattern. Image is there at the end guys somewhere. Then MLH1, MSH2, MSH6, that is seen in HNPCC, hereditary non-polyposis colon cancer, also known as Lynch syndrome, that causes carcinoma, CEO, carcinoma, endometrium and ovary, colon, endometrium, ovary. WT1, you have chromosome 11, that is Wilms tumor guys. Then RAT, that is medullary carcinoma, thyroid, Men's syndrome. This was a this year INICT question. They have exactly shown you this image, that is the crumpled tissue appearance cell, that is the Gaucher cell. If they ask you pseudo Gaucher, that is seen in your CML guys. Okay, so this is the hypersensitivity mnemonic we have already discussed guys in our last wala BTR. Okay, so just have a look. Allergy ABCD guys. Type 2, my blood group is RH positive. Myasthenia, blood transfusion, Graves disease, ITP, RH incompatibility, pemphigus guys. Type 3 sharp, S for SLE, serum sickness, H for HSP guys, A for arthros reaction, R for Rajesh, P for PSGN. Type for all the granuloma wala things guys. Okay, so this is the same thing guys that I have tried to include. Okay. Now coming on to the list of autosomal dominant and recessive guys, we have already discussed how to identify the flowchart guys. Okay, if you see think we have already discussed it, so I think no more confusion over those flowcharts guys. Okay, so see, dominant guys, remember he has a dominant father. H for hereditary guys. Okay, E for Ehlers-Danlos. Okay, achondroplasia. Dominant. D for dystrophica myotonica. O for osteogenesis imperfecta. M for Marfan syndrome guys. I for intermittent porphyria. N for neurofibromatous. A for autosomal dominant polycystic kidney disease. N for Noonan syndrome. T for tuberous sclerosis guys. For autosomal recessive, what I remember the mnemonic is the past chawal guys. P for phenylketonuria, A for albinism, S for sickle cell, T for thalassemia, C for cystic fibrosis, H for hereditary problem. Okay, A for albinism, W for Wilson disease guys, L for all lysosomal storage disorder except Fabry's and the Hunter's guys. X-linked you have very few. That is, one is the Rett syndrome that you need to remember, Alport syndrome that you need to remember, and X-linked recessive guys. Okay, remember guys, like A B C D wala thing is there. Okay, there you have hemophilia A, hemophilia B, C for chronic glomerulonephritis disease, D for Duchenne muscular dystrophy guys, Viscott-Aldrich, F for Fabry disease guys. Okay, so this is Leishman syndrome. So this are a lot about your X-linked recessive disorder. So this is the CD marker. Most of them we have done now also guys, and this we have done in last BTR also, so we won't be doing again guys, same thing. Okay, this is basically your important HLA guys. This we have also done. So this is again a important stem cell ka marker. This we have not done last time, so it's same thing. So let's do this time. This one is the hematopoietic stem cell, that is CD34. WBC, that is common leukocyte antigen, CD45. Myeloid cells guys, you have multiple lineages, not so important. Then lymphoid B cell, CD19, 20, 22 guys. Okay, CD19 is the pan B cell marker, and PAX5 is the B cell maturation marker. Pan T cell marker is the CD3 guys. NK cells is the CD16 and 56 guys. Receptor is CD21, CR2 guys. Okay, that is important. Reed Steinberg says CD15, 30 and PAX5 guys. Okay, Allen is the type of cell, that is guys non-nodular lymphocyte predominant Hodgkin's lymphoma guys. That is your CD15, 30 is negative, but instead here 20 and 45 is positive. Also EMA is positive. Mental cell lymphoma, EL, that is 11, translocation 1122 guys in, sorry, translocation 1114 guys here in mental, and that is your CD5 positive but CD23 negative. SOX11 more specific. CLL guys, that is both positive guys. Here you have small cell due to Vimentin defect. Then monocyte guys. Okay, mono is 4 letters, so 14 and 64, remember like this. Okay, then you remember this natural killer. Remember killer is 6 letter, that is 16 and 56 guys. Okay, then you have platelets guys. You have platelet 41 and 61 guys. That is again important. So this was about the gene guys. See, we have seen most of them. P15 located on 17p13, retinoblastoma 13q14, NF1 count the letter 17 letter, NF2 2 22, BRCA1 17, BRCA2 again 13, WT1 that is 11p13, 11p15, P10 10 10, VHL 3 letter 3, APC guys, P for patch, that is 5. Okay, see, this is basically what we have read till now, basically a form of matching type. Okay, let's see. Alpha fetoprotein protein guys, where it will go guys, have a look guys. Alpha fetoprotein guys. Okay, that will go to hepatocellular carcinoma guys. Okay, see, try to see answers are marked guys. So just see, multiple myeloma, immunoglobulin guys, HCC alpha fetoprotein, choriocarcinoma beta SCG hydatidiform mole wala thing, medullary carcinoma source calcitonin, carcinoma thick. Okay, then ovarian cancer guys, if there is epithelial ovarian, that is CA125 guys. Okay, then pheochromocytoma guys, ketocolamine. Pancreatic cancer 9 you can make into a P. Colon cancer guys, CEA, carcinoembryonic antigen. Breast cancer 3 can be made into a B. Then see, let's see here guys. CD99 also known as MYC2, Senin-Ewing sarcoma. CD1A guys. Okay, CD1A, CD207 Langren, that is Langerhans cell histocytosis. CD45RO guys, this is very important. This is seen in memory cells guys. Okay, then CD34 basically stem cell endothelial cell guys. CD31 that is transmigration ka molecule, PCAM molecule, that is dipedeasis. CD117 c-kit ka molecule, gist wala molecule, seminoma guys, games. CD21 guys. Okay, this CD21 is seen in Epstein-Barr virus, CD21 CR2. Then CD28 is a co-stimulatory molecule of the T cell. Okay, and CD40 is a co-stimulatory molecule of the B cell, that is your CD40. T cell is CD28 guys. Now coming on to that other important high point about SLE guys. Okay, most sensitive antibody for SLE is the anti-nuclear antibody. Most specific anti-Smith. Both are there, so anti-double S, double we do. Okay, then drug induced is your histone guys. Okay, then LE bodies or hematoxylin bodies guys. Okay, that is there. Okay, LE bodies, they are phagocytic leukocytes that have engulfed the LE bodies. Then you have classification: minimal mesangial loopal, focal proliferative, diffuse proliferative. This is important. This four letters, so this produces wild loop lesion guys. 5 membranous glomerulonephritis, 6 for lupus nephritis, that is the worst prognosis. SLE, if you arrange it, that is LSE, limb sac endocarditis. In spleen you can have perivascular fibrosis leading to onion skin appearance guys. Okay, so see, that is the same thing guys. Neonatal lupus, that is anti-RO guys. This same table has already been discussed guys. P anka, that is PMC, microscopic polyngitis, Churg-Strauss syndrome guys. C anka, that is seen in venous disease. Anti-Saccharomyces cerevisiae, that is seen in Crohn's disease, guys. Okay. Anti-topoisomerase, if you are in the center, guys, that is limited, guys, that is limited scleroderma. Anti-topoisomerase is generalized scleroderma, guys, again important. Okay, so this is all the strawberry that you will come. Strawberry tongue seen in Kawasaki disease and scarlet fever. Gums, that is seen in your vagus. Gallbladder cholestasis. Cervix trichomoniasis. Nevus, that is capillary hemangioma. Mass rhinosporidiasis, the figure that you see here, guys. Shaped skull, that is your Edward syndrome. Skin, that is your sarcoidosis, guys. And rectosigmoid, spirochete or Borrelia, guys. Okay. So now coming on to the all the pathological lesions, guys, that you see here, guys. Okay. So let's do the pathological lesion. So coming on to the asteroid body or the Schaumann body, guys. S for Schaumann, A for asteroid, that is seen in sarcoidosis, guys. Ashkoff body, see, only reason of doing this is because it has images, guys. Bollinger foul ball, guys. Okay, foul pox. Okay, call external, call the granny, that is your granulosa cell tumor. Civet body, that is seen in lichen planus. Councilman body, hepatocytes that undergoes apoptosis, guys, acute viral hepatitis. Pathological bodies in asthma, guys, you have 3C, that is Crayola body, Crushman spiral and Charcot-Leyden crystal, guys. Okay, so that is important, and this is made up of galectin 10. This is the discomated cell, that is the Crayola body. Cowdy type A, guys. Okay, this type A and B both are intranuclear. B is seen in BAP, that is adenovirus and poliovirus. A is seen in, guys, HAY, that is herpes and yellow fever. Yellow fever shows the presence of Toll's body, and H for herpes shows Lipschul's body. Then Duchenne, Resser, Mott cell, flame cell, guys, seen in multiple myeloma. Ferruginous body, guys, asbestosis. Then Guarinari body, okay, that is C, can be made into a G, vaccinia. Hellberger-Probojawski body, that is seen in trachoma, guys. Okay, HP body, okay, this is again a PYQ, that is seen in molluscum contagiosum infection, guys. Again important, that thing that may be asked in your exam, guys, that is Henderson-Peterson body. And here the special stain is floxin tartarate stain, and here you have a basically a raised elevated lesion which has a cheesy material coming out. Hinge body seen in G6PD. Howell-Jolly body seen in asplenia, thalassemia, guys. Leishmania Donovan in Kala-Azar. Leventhal-Cole body in psittacosis, guys. Then Levy body in Parkinson disease. Mallory tank made up of cytokeratin 818, New Indian Watch. That is NASH, Indian for Indian childhood cirrhosis. W for Wilson, A for alcoholic liver, T for tumors like hepatocellular, C for cirrhosis. Mason body seen in boob, that is bronchiolitis obliterans organizing pneumonia. Okay, then Miyagawa body seen in lymphogranuloma venenum. Hirano bodies, guys, which is seen in your Alzheimer's disease. Then Gamma Gandhi body is seen in congestive splenomegaly, guys, portal hypertension. Negri body seen in rabies. Niesel's body, that is the cytoplasmic inclusion in neuron. Michaelis Guttman seen in malakoplakia. Pappenheimer body seen in sideroblastic anemia. Then Samoma body already done, guys. Donovan body seen in granuloma inguinal. Passion body seen in variola. Okay. Then Seeler-Duval, see, this is the Seeler-Duval body which we have already talked about, seen in yolk sac or in the endodermal sinus tuber. Varicose body seen in basically your schwannoma, nudilemoma, that is Antony. A means a lot of, B means blank, guys. Okay, see, this is all the body. See, we'll see if there is something special, guys. Gamma Gondy splenomegaly. Negri body is rabies, guys. Okay, Hirano body is done Alzheimer. Levi body is Parkinson. Ferruginous body asbestosis. Asteroid body sarcoidosis and sporotrichosis. Schaumann body sarcoidosis. Varicose body schwannoma. Call external, call the granny, granulosa. Seeler-Duval endodermal sinus. Ashkoff bodies rheumatic fever. Civet body lichen planus. Crayola body bronchial asthma. Donovan body lymphogranuloma venenum. This is very important. Henderson-Peterson molluscum contagiosum. This is important image based question. Michaelis Guttman malakoplakia. Pig body is pig disease. Zebra body metachromatic leukodystrophy. Bar body inactivated X chromosome. Camino bodies is seen in malignant melanoma or the spitz nevus, guys. Okay. Then Hinge body G6 Howell-Jolly already done, guys. Okay. See, most of the bodies we have already done, guys. We have one more body, Lafora bodies, myoclonic epilepsy. Just have a look at it, guys. Okay, so this is some more bodies, guys. That is Bununa body seen in amylotropic lateral disorder. That is the upper motor plus lower motor ka combined wala thing. Okay, that is important. Then this body of Highmore is seen in mediastinal testis, guys. That may be tested upon. Okay, then see, other thing that may be tested upon, guys, that can ask, this Rokitansky tubercle is seen in teratoma, guys. Okay, that is again important, that may be asked to you. See, this Malady hyaline body already done, guys. Cytokeratin 818 guy important. Okay. See, this is the tumor marker. Just have a look, guys. I think everything is covered, guys. Nothing is left. B cell 19, 20, 21, 22. Pan B cell 19. Pan T cell CD3 1, 2, 3, 5, 7. Natural killer cell killer 6 letters 16 and 56. D Steinberg cell 15 and 30, guys. Okay. Popcorn cells 20, 45. That is LNH cell, guys. Okay. Mental cell CD5. Chronic both positive, guys. Hairy cell 125, 103, guys. Seminoma beta SCG PLAP, choriocarcinoma SCG, York-Sac alpha pito, Sertoli cell inhibin, medullary carcinoma, calcitonin, Ewing sarcoma, CD19 and MIC2. Now coming on to some important appearance, guys. This fried egg appearance we talk about, that is seen in oligodendroglioma, hairy cell leukemia, shish kebab, guys, candidiasis. Banana shaped gametocyte, that is your Plasmodium falciparum. Anchovy sauce seen in amoebic liver abscess. Apple jelly nodules in lupus vulgaris. Okay, then you have, guys, Langerhans cell histiocytosis, Brenner's tumor, granulosa cell, all are coffee bean nuclei, guys. Okay, donut Q, make a Q out of donut, guys. Cola shaped urine, that is acute glomerulonephritis, post streptococcal glomerulonephritis. Now see, fever, interleukin 1, shock cachexia, that is TNF alpha, guys. Angiogenesis, vascular endothelial growth factor. Fibrosis, beta, transforming growth factor beta. Okay, then anti-inflammatory, guys, that is 4, 6, 10, 13 TGF beta. Both pro and anti-inflammatory, this is important. 4 and 6 people are both pro and anti-inflammatory, guys. Okay. So see, this is some important points of basically the revision of path, guys. This will be doing. See, before that we'll be seeing some of the important images, guys, here. See, then coming to C Anka and the P Anka, guys. This C Anka, that is against PR3, guys. Okay, so how to remember, guys? Remember CW, guys, classwork, guys, and W, when you remember Wipro. Okay, that is against the PR3, and example is Wegener's. P Anka, remember PMC, that is microscopic polyangiitis, Churg-Strauss syndrome, and also in ulcerative colitis, guys. Okay, this P Anka is also known as MP Anka, that is myeloperoxidase Anka, guys. Okay, and also seen in PSC, guys, that is primary sclerosing cholangitis, guys. Okay, see, now coming on to know about the chicken wire appearance, guys. This chicken wire calcification is seen in chondroblastoma bone tumor, guys. Okay, it is also seen in cirrhosis of liver, and this chicken wire blood vessel is seen in your oligodendroglioma, that is a brain tumor, guys, where you have 1p19 co-deletion. Okay, now coming on to the onion skin in the medicine, guys. Okay, so basically in the malignant hypertension you see onion skinning, splenic capsule in your HLE, guys, primary sclerosing cholangitis, Tay-Sachs disease on electron microscopy. Okay, then you have x-ray of the Ewing sarcoma. Okay, then Samoma body is already done, guys. You see there is a basophilic calcium ring all around, guys, that is PSM. Okay, then Samoma bodies and keratin pulse, guys. Okay, so keratin materials, basically you have parakeratosis and you have eosinophil. It appears pink, and Samoma bodies appear blue, that is basophilic calcium ke karan. Now coming on to this coffee bean ka nuclei, guys, that is seen in papillary carcinoma, thyroid, Langerhans cell histiocytosis, brew the coffee grain, Brenner's, and G for granulosa, guys. Okay, that is important. You can remember this Papa Lau coffee grain. Okay, that is Papa Lau and brew the grain. Okay, Papa for papillary, Lau for Langerhans cell histiocytosis. When you see Brenner cell, you have two things. One is the nesting of the tumor cell known as the Walther nest, and N for the nuclei, that is coffee bean nuclei, guys. Okay, this photos has been taken from, this one has been taken from Vanna Puri ma'am Facebook page, guys. Then VRAF, V6 and AD, guys. LCH, if you do ulta, that is SCH, SCL. Then 2P, papillary carcinoma, thyroid, pilocytic astrocytoma. M for melanoma and C for colorectal carcinoma, guys. Okay, not from Vannapuri, I think somewhere else, guys, I'm not very sure. See, hairy cell leukemia, you have the fried egg appearance, guys, and look at the image, guys, bone marrow biopsy and peripheral smear. Then melanoma will show the presence of melanin, guys. Okay, Langerhans cell histiocytosis, guys, you have coffee bean nuclei and you have eosinophil, the most important finding. Then colorectal carcinoma, you have invasive tubular glands. Then papillary carcinoma, guys, you have orphan ani nuclei, Samoma bodies, coffee bean nuclei, and pseudo inclusion, guys. Then you have pilocytic sarcoma, so GFAP positive Rosenthal fibers are there, guys. That is again important, which you need to know, guys. Okay, Then coming on to the glomerular body, that is seen in two places, guys. One is the glioblastoma multiforme, and one is the Sheila dual body in yolk sac tumor. Then glioblastoma, which is not known as multiforme now, which is a brain tumor, guys. Okay, fried egg appearance seen in hairy cell leukemia and oligodendroglioma. Then few important images, guys. Acanthocytes, which has unequal projection known as the spur cells, guys. If it is equal cell, that is bud cell, guys. Okay, kynocyte. Azopardy, basophilic staining of the vessel wall seen in small cell carcinoma of the lung. Schwannoma, that is varicose bodies, guys. Antony A, Antony B. Ground glass or Orson cicata stain, guys. Okay, that is used to stain the organism, guys. Okay. So guys, this is all about we'll be seeing in the first part, guys. Okay, so hopefully I'll be making a second part soon, guys. If you like it, guys, do comment, like, share and subscribe, guys. See, notes has already been made, but like completing it in one go would be hectic for you also to watch and for me also to record, guys. Okay, so we'll be doing it in the next part, guys. Okay, so if you like it, please do comment, like, share and subscribe. Thank you, guys. Happy learning.